All right, welcome everyone to CNS Connect Webinar Series. My name is Amy Smith and I'm the Director of Certifications for the BCNS and the ANA. Today I'm joined by Emily, who's going to share her expertise on when and where to refer out. If you have any questions about the presentation, please feel free to put them in the Q&A or in the chat. And this presentation will be worth 1 CEU for CNSs, so I will put the survey in the chat towards the end of the webinar. So let me tell you a little about our presenter today. Emily is a CNS, a licensed dietitian nutritionist, and a certified lactation counselor and BCNS supervisor. She specializes in women's health and physiology and pediatrics. She is a virtual private practice and CNS supervision program that focuses in this niche. Emily has 6 years of experience with nutrition counseling in the public health setting, medical nutrition therapy with insurance companies, and functional nutrition counseling in her private practice. Emily has 2 nutrition degrees from Indiana University of Pennsylvania. She is passionate about bridging the gap between conventional and functional health modalities, and this is a big focus for her nutrition supervision program called the Women in Nutrition Supervision Program. Her supervision and mentorship program offers group cohort calls, one-on-one support, lunch and learns, and a functional nutrition learning modules. All right, thank you so much, Emily, for joining us today, and I will turn it over to you. You stop sharing here. So then I'll let you share, and I'll make sure we can see it.
Okay. Let's see. Can you see my slide?
It's working. Oh, perfect. Yep, we've got it.
All righty, perfect. So let me minimize so that these images are out of my way. Okay, so thank you for the introduction. My name is Emily Kilar, and I want to talk about when and where to refer out. Okay, so thank you for the info. Yes, I am a licensed dietitian, CNS, CLC, and a CNS supervisor. To give you a little context of where I'm coming from and my background, I am conventionally trained in dietetics. I originally thought that I wanted to be a dietitian. Back in 2012 is when I started college, and this was really the only path that I was aware of to become a nutrition professional. So I went on the dietetics path, and I quickly learned that there was limitations to only practicing disease-based care. And so I went on to get my master's and to become a CNS. It was important for me to be licensed as a dietitian, to utilize those skills, and I do take insurance right now. But I really love the functional side of things. And I think there's a big disconnect with being able to bridge the two worlds. And that is something I really like to focus on, because most of our patients and clients, they are seeing conventional providers and or maybe functional providers. So my practice is all virtual, and I sort of have this hybrid of cash-based and insurance. So I do take Highmark Blue Cross Blue Shield in the state of Pennsylvania. Because really I did that before and I knew how to operate in that system. It has a lot of limitations, but I still want to be able to offer that for my local people. And then most of this is cash-based. My specialty focus, or my niche, is women's health and pediatrics. I started with that because I worked at the WIC program in Pennsylvania for about 4 years. And I absolutely loved working with women and dealing with pregnancy, breastfeeding, and preconception. So preconception care and fertility is some of my favorite cases to work with, but I also work with disease states, functional conditions, and mystery cases. I really love to investigate, and help support clients and to find what is going on with their health and how I can be of assistance as a nutritionist, but also sort of a health advocate and how to help them navigate the medical world. Okay, so what we're going to be talking about today, understanding the importance of referring out, because we are nutrition professionals, but we don't know everything. And so we do need to refer out at times. Understanding when referring out is going to be appropriate and necessary, understanding which medical professionals we should be referring to. And I will also share a few case study examples, talk through those, and then questions and answers. Okay, so why would referring out be an important skill for us to have? So what's really unique in the nutritionist role is that we are understanding so many body systems. We're having discussions. Nutrition and food plays a role in overall health. There's no way to dispute that. And conversations come up that are very complex. They can cross over into psychology and medical conditions, all different things. So whenever we hear things that we are not able to take on, like a lot of trauma or something like that, we are not therapists, psychotherapists, or psychiatrists. So we would want to refer out when something does not fit within our scope of practice or our area of expertise. And really, we want our clients to be healthy and well. And so we want to be supportive and helping them to navigate if there is something that comes up that they need a referral to, if we have a referral to give them or to help suggest how to go seek out a different provider, that would be very, very helpful. Okay, so let's think about how we can understand our clients' needs and our role as their healthcare provider. So thinking about the nutrition professional and the scope of practice, what are we doing? We are providing medical nutrition therapy if we are licensed and or a dietitian. We are not diagnosing and prescribing and treating. And that verbiage is very important because nutrition professionals do not treat and we do not diagnose. We are helpful for collaborating care and referring out. So understanding the client's healthcare needs. So during the nutrition assessment or the health timeline review, whatever you want to call that first appointment, your intake forms can be a starting place to understand like who is on the healthcare team. I ask this in my intake form, and I really love this question because I want to know, is this person coming to me somebody who has not seen a doctor in years? Is this person coming to me as somebody who has done therapy for 15 years and is very self-aware? There can be a spectrum of different clients and patients. And so getting to know them and who is on their healthcare team, I find to be a very valuable question to ask. So in my intake form, I kind of have a little drop down and they can check off who they are seeing. And if somebody does work with a functional provider, I love to ask about that experience. It's very interesting. Sometimes people have had really great experiences or maybe the opposite. And being in nutrition, we specialize in this area. I've heard some interesting conversations from other functional providers that did not necessarily specialize in nutrition, but tried to take on the nutrition conversation. And some of my clients just did not have a good experience with that. And that's maybe why they came to me. We can also be assessing through symptom questionnaire to kind of see, wow, like, are there, problem areas in the neurological concerns or the GI concerns, for example, and thinking, have you seen a GI doctor before? Follow-up questionnaires and or sessions also. Okay, so I wanted to make this little graphic to reiterate, kind of our roles in the healthcare world. So medical professionals are, the MDs, medical doctors, DOs, physician assistants, nurse practitioners, and naturopathic doctors in some states. If I have missed any prescribing or diagnosing credentialed professionals, then I apologize. That's kind of what came to mind. So their primary role is to be the professional who diagnoses, tells the person what their condition or disease is, and they can offer the treatments, which the treatments are sometimes limited with procedures, surgeries, medications. That is not the only way that we can take care of diseases and medical concerns, as we know. But that is the professional, especially for the diagnosis piece. And we cannot do that as nutrition professionals. So that is a big reason that I like to refer out, is because if there's no diagnosis and I'm suspicious based on labs or conversations, I want them to get that diagnosis, because I want them to have the starting point for them to understand how they may be able to take care of their condition or disease. That part is up to them, and there are different routes to take, but the diagnosis has to come from those physicians and medical providers. And so nutrition professionals, our role is really to be providing the nutrition therapy. But we're in a very unique position, because sometimes we are performing nutrition-focused physical examination, nutrition diagnosis, and nutrition prescription and interventions. The dietitian and CNS professionals, we can help assist in the diagnosis, but we cannot diagnose. Just a quick idea I have here on this is thinking about an eating disorder. So there have been clients that came to me and, kind of broke down and discussed with me that they are concerned that they may have an eating disorder. So as a nutrition professional, I cannot diagnose and confirm that and say, yes, you do have an eating disorder, even though I can tell based on diagnostic criteria that would fit. I would have to refer out to the medical professional to make that diagnosis. And also, I do take insurance, and the way that this works is medical nutrition therapy can be covered if you have a diagnosis from a physician. So if somebody has bulimia and they come to you and they have not previously seen a doctor that says you have bulimia, you have to send them to the physician. And then the way that you submit to insurance, you actually take that documentation from the physician that says that they have a diagnosis, and you submit it with the insurance to prove that diagnosis. There is one diagnosis that dietitians are able to do for medical nutrition therapy, and that is obesity. As long as we can calculate BMI, we can prove and we can diagnose obesity, but that is it. Okay. So I have a question for you guys. I want to see how you would answer this. So if you want to put it in the chat, let's focus this question for the chat box. Which professional is the #1 referral that I make as a CNS? So who am I sending my clients to the most, or recommending that they go visit this professional? Do you think it's a mental health therapist, a functional medicine practitioner, or a PCP, primary care, or general practitioner? Okay, so I have a couple answers here for a mental health therapist or professional. PCP. Any other guesses? Alrighty. So my #1 referral is to the PCP. So there's quite a few reasons for this. I think it's on my next slide. Let me see. Nope. Okay. Got to go off memory. Okay. So the reason to back up a bit, in my first consult, I always ask, like I said, who are you seeing? And if I notice that someone is not having a PCP on their team, I ask about that. And I say, well, are you having trouble finding one? Did they just move? Do they not take your insurance? I try to understand why they're not having a PCP that they go to. And I've heard of, a few different reasons, one of which was, oh, well, I just don't really need to go to the doctor. And this is a great time to have a conversation. And how I would respond is, I completely understand. I'm so glad that you are healthy and that you have not needed any medications, or, you haven't needed to see a provider. However, it would be a good idea to be visiting a PCP once a year for your physical, for your checkup, and to be building a relationship in case anything were to happen medically, that you want to have a doctor that you trust and that you can go to. I'm so happy that you don't need that right now, but I really think it would be a good idea. I encourage you to make an appointment, maybe do a doctor match quiz. I often recommend that to clients so that they can maybe find a PCP, ask around, ask their family and friends if they have a PCP that they connect with and that they really enjoy. And yeah, we still do need to have those physical checkups once a year. But I also do recommend to mental health therapists quite often. It's very interesting how much psychology is tied with nutrition care. And to be honest, people cry to me all the time, and I have to listen and hold space sometimes, but I'm really not the appropriate provider to be processing things like trauma and abuse. So that would definitely be, recommending to refer out to a mental health therapist. Okay, so common referrals for nutrition professionals. I'm just going to go through a few of these. The primary care, we just talked about that. Oh, and pediatricians. Most parents are really good with, keeping up with pediatric appointments for their annual physicals. Also, for ordering labs. So the way that I handle this is, I know that I cannot diagnose, but I am absolutely running labs if I have to. And I will really help assist and advocate my clients and patients for figuring out the root cause of some of their health concerns. And I think that diagnosis is a very important part of that, because if you don't have the diagnosis, even let's say ADHD, for example, if you don't have a diagnosis, you don't have options for treatment. And yes, there are options that are pharmaceutical and there are non-pharmaceutical options, but if you don't know that you have a condition, then you don't seek out treatment, or you don't understand yourself as thoroughly. And so those diagnoses are very, very helpful. So the way I'm going to show in a second an example of a letter, but my first preference is that when I want labs ordered, even thyroid panels, CBC, CMP, some nutrients, I want their doctor to order it, because if anything were to come up, let's say cholesterol, we have extremely high cholesterol and this person needs to go to a genetic counselor and roll out if they have a genetic reasoning for this super high cholesterol. I want their PCP to just already have that, and then the PCP is going to take them in and refer them to that genetic counselor, for example. And then, of course, if they need medications, I want that to be in the doctor's hands. And then I want the labs to get to me, and I can sit down and I have time to review and interpret the labs with my clients. But that is my preference. If not, there are other ways through third-party testing to get labs done, but that is my preference. And then also, the primary care physician can triage. They can really understand, if you send a message in your My Chart to the PCP and you say, I'm having X, Y, and Z going on, do you think I should go to the ER? They can help direct you in your care. And they also have obviously a huge line of referrals, and they understand your insurance and other practitioners that they've collaborated with. And so maybe they prefer that you see a certain GI specialist because you're having a pancreatic issue, and or your client is having a pancreatic issue. And so there is one doctor that they know does specialize in that, instead of just booking with a random GI doctor who doesn't really specialize in that condition. Specialist. I've noticed that some of my clients don't even know about these specialists and their role. And again, when you are in the nutritionist role, you are hearing so many things that perhaps these people are not disclosing to their doctors due to time. And so we get this very long story of their health. And so the different specialists that we may be suggesting or asking to ask their doctor for referral, GI, allergist, endocrinologist, reproductive endocrinologist. There are so many people struggling with infertility, and they have no idea that reproductive endocrinologists are the people that can really assist there. Neurologists, cardiologists, genetic counselors, etc. I did not know that genetic counselors even existed until recently through my own experience and my own health journey, and then also with clients, because I do see genetic abnormalities, inborn errors in metabolism, and I really love those. I think they're super, super interesting. Okay, and so then functional medicine providers like functional doctors and naturopathic doctors, maybe for more complex medical concerns where we know the root cause might not be very apparent, where conventional medicine sometimes there's limitations in this area because they have certain procedures and testings that are very common, but what if their condition is something that is not normally tested, and maybe it's something a little more complicated, and maybe the naturopathic or functional doctors have seen that and are more aware of those types of complex conditions. The gynecologists and dentists, I also love, especially when thinking about preconception, hey, are you seeing a dentist every year, twice a year? Are you seeing the gynecologist? Checking in on that to see how they are doing. And then lactation specialists. Again, a lot of people do not even know about these professionals. These are IBCLC stands for International Board Certified Lactation Consultants. These are the professionals in the hospitals. They can, there is vigorous training to become an IBCLC, and very, very helpful. Anytime a woman is having challenges with breastfeeding, I always recommend, do you want to see your own IBCLC? There are tons of resources. I know in my area, when I worked for the WIC program, we actually have a call line through our local health department for women to be able to just speak on the phone, even to get guidance there. And that's usually a CLC who's answering the call, sometimes an IBCLC. A CLC, I also have this certification as a certified lactation counselor. So the training is not as medically extensive as an IBCLC, but the CLCs are very trained in how to kind of be in the counselor role for a woman who is breastfeeding. Okay, so here's an actual, I just took this from one of my clients. This is a letter that I sent over. I sent it to her to send to her doctor. If she wanted me to fax it to her doctor, I would be happy to do that. So when I was saying that I typically want the labs to be ordered through their physician, even though I have the ability through third-party testing to order these, I just like to be part of the team, and I want my clients to feel that way. I want them to know that if their doctor has any questions about what we are working through and my role in their nutrition care, I want them to be aware of it. So I just kind of introduce myself a little and say who I am, what we're doing here, some of the dietary recommendations, and then labs. So, and then I list out the labs. And this typically goes over so well. I want my clients to use their insurance. I mean, they're paying so much money, and functional testing is so expensive. So, and paying out of pocket to see us, I want them to be able to utilize their insurance when possible. And so I try to advocate for them. And if this is just a small thing I can do, I love to do it. And it usually, again, goes very well. But if not, sometimes I think it's more so to the fact that some physicians don't know how to interpret some of the labs that I'm requesting. So for example, these are hormones. So I recommended she ask her, gynecologist for the hormones, and then maybe PCP for other labs. So this tends to work out pretty well. And other times my clients say, oh, I can just ask my doctor, no problem. I'll send a message on my chart. But I just wanted to show a little example of what I do so that I'm kind of informing the physician. And also if they want to coordinate care, I have my contact information here. And of course, ROI form, release of information, if the patient or client would like to have you communicate with the other providers. While it's on my mind, in terms of eating disorders, because I do take on clients with eating disorders for medical nutrition therapy, you have to communicate with their physician, their therapist. You have to understand the treatment plan all the way around as an outpatient dietitian. And so I have had to have many phone calls with these therapists, and I do have a lot of phone calls with therapists, even for clients that don't have eating disorders, because I find it to be very helpful to kind of understand the treatment plan of action with the other providers. So I'm very happy to coordinate care and to refer out as needed. All righty, so let's talk about when might be appropriate to refer out. So anytime you see a red flag for something that you feel might be an undiagnosed disease, which, let's face it, I mean, the statistics on undiagnosed hypothyroidism and Hashimoto's is very high. I don't know the number, but it happens all the time. I'm going to talk about that in a second. But some things to maybe look for, if you hear these red flags, you could think, oh goodness, do you have a diagnosis? Are you working with someone for these problems? So a couple of things I have here: blood in the stool, that's never normal, especially for pediatrics. Anaphylaxis, allergy symptoms, rashes. It's perplexes me that there's so many clients of mine that have severe rashes and dermographia, and they don't even tell their doctor. I didn't think they cared. I'm like, well, it's meaningful. And it's meaningful for me because I understand the connection with the gut and the skin. So severe menstrual bleeding and pain. I once had a client that actually told her physician that she had severe menstrual bleeding, bleeding through clothing at work. And she was, approaching menopause age, but she was not in perimenopause yet. And we had to advocate for her because her doctor was dismissing her. And I said, no, that's seriously not normal. I want you to push for, some testing. And so she had some ultrasounds done, and she did have an obstruction. So she had a polyp that needed to be removed that was causing all of this excessive bleeding and anemia. So sometimes it's also advocating for the patient, and, well, if that doctor didn't listen, maybe somebody else will. Malnutrition, oh my goodness, distorted eating patterns, suspected eating disorders. Like I said, even though I can do treatment for medical nutrition therapy for eating disorders, if someone tells me they suspect that they have anorexia, bulimia, any type of eating disorder, I'm going to refer out for them to get that diagnosis. They can come back to me if they would like. They could do whatever treatment options, but they need to know their treatment options. I can't just keep that between the two of us. I have to refer them out to have that diagnosed. And anytime there's significant weight loss or weight gain. So, of course, for mental health disorders, if you hear anything about self-harm, suicidal ideations or thought process, severe depression, panic attacks, abuse, and trauma. This one's tricky because I have had sessions where 30 minutes goes by and I think that the patient is forgetting that I am not their therapist. So I have to sort of remind them sometimes. And if they do have a therapist, that's a great opportunity to say, wow, thank you, for sharing. That was really difficult. I think that'd be a really good thing for you to process with your therapist. And then if they don't have a therapist, saying, well, that would also be, something really wonderful to talk to a therapist about who is professionally trained and can help guide you in that area. So sometimes open to it, but then when you have that conversation and you have to remind them, I'm not the therapist, I'm not, I'm here to listen and everything, but that's the job of a different professional. I've had to have that conversation several times. eat disorder, they're very. So I actually ended up contacting a local eating disorder facility, which most like towns and cities have. If you are looking for a resource, look for kind of like the big centers. And then I actually spoke with somebody and they were able to give me a list of eating disorder focused therapists who are outpatient. And I gave her that list and she was able to establish care with a new therapist. She was reluctant to do that because her other therapist, she felt, didn't even understand her eating disorder. But again, I cannot be all of those professionals when I had to refer out. So, and then other red flags in lab testing. I'm going to show a couple examples of this. So, if you find something in labs that you have ordered yourself, functional or conventional, explaining the importance, you really need to speak to your provider about this because, of course, we can't diagnose. And so we need to make sure that that person has that information and can give the proper diagnosis and treatment options. So if that does happen, that you find something kind of scary, you can always offer to relay that information to the doctor for them. You can have them sign a release of information document and fax them their results or have them take it to their physician or call. So there are options there. All right, so let's talk about some times that I've had to make referrals. So this was a client who had diagnosed celiac disease, and she was coming to me because she actually developed a very poor relationship with food because of her restriction. And she was really struggling with weight gain and concerns about her weight and also the autoimmune disease. And so actually it was one of my friends who's a dietitian that referred her to come to see me because I specialize with autoimmunity. And so we ran a GI map and it was very interesting to hear her eating patterns because she would not eat out at all because she was so scared of cross-contamination. So she would actually bring all of her meals everywhere she went. She was under so much stress. And I also heard about all of these other GI complications. And I asked her about her experience with her GI doctor, and she had the scope years ago, and they just say, here's your gluten-free diet. They didn't monitor her. And also they put her on a low FODMAP diet she was on it for like 15 years. And they never gave her a plan of this low FODMAP diet. So she's just on this low FODMAP diet. She says like no foods to eat and she's just stressed out. So anyhow, this is part of the GI map test. Towards the end of the results, we see the intestinal health markers. That's my favorite part. And so when I saw the secretory IgA is very high, so her immune system is basically responding quite high. And, that's an indicator of something for me as a clinician. But this marker, the anti-gliadin IgA, is an immune response marker, an antibody response to gluten. So what this tells me is she is being exposed to gluten, and the cutoff, she just landed here at 500. I don't even know how high that number was, but she is getting gluten in her body and she is reacting to it. And so that was a difficult conversation to have, that you actually are being exposed to gluten. I don't know where, but because of this result and then other parts of her GI map, she did have candida and severe dysbiosis. There was so much going on with her gut that I really wanted to refer her back to her GI doctor because I wanted to know, I just wanted to make sure she doesn't have damage to her small intestine from the celiac condition. So if she is by doing this test, we see that she actually is being exposed to gluten. I don't know where, we have to investigate that, but I wanted her to tell her GI doctor about this to see and to go in and check. I don't know what they will do, if they will do another scope or how they will run some nutrient markers to see if she's malnourishing. But because of the complexity of the test and then this marker, I wanted her doctor to be aware of her celiac condition to monitor that. Okay, so this is an interesting situation. So I had a client that she is looking to conceive. She's gone through IVF that has failed a few times, and she has a condition, I always forget, primary ovarian insufficiency. That's what it is. So it's basically, it's almost kind of like premature menopause. Her ovaries are not producing eggs, and she's only 39 years old. So I started, like I said, I have a lot of mystery cases, and I have to run a lot of labs to kind of even understand the person's condition and what's going on. And I started with some thyroid markers, and this is my handwriting because I'm old school. I like to kind of write things out. And the first time we did thyroid labs here, this was in April, her TSH was high. And I thought, well, I think that we need to address that because fertility, even gynecologists conventionally trained, they are in agreement that a TSH above 2.5 is not optimal for fertility, and so she's too high. And so thinking about the thyroid here, I cannot prescribe medication, nor would I really recommend that in this case. Like, considering her, I have seen TSH be elevated due to toxins or malnourishment, stress, different things. And so I feel very comfortable taking on nutrition support in this area to help normalize thyroid levels. But nonetheless, she actually did go on a microdose of thyroid medication. She actually was a physician herself, and that felt right for her. Again, she gets to choose the treatment, and that was important for her to be referred to a reproductive endocrinologist who could offer that. And then also down here, I have some of her sex hormones, and I just saw, her ovaries are not making any estrogen, and this was just kind of scary. And so if we want her to be ovulating and to even maybe do an egg retrieval for IVF in the future, we have to be rejuvenating the ovaries and make sure that they are producing. And so again, like hormone replacement therapy in terms of thyroid medication and or other hormones, that's not something I could offer her. And so we had to refer out. Over here on the left, I had her do a temp drop. This is a BBT, basal body temperature tracking device that you wear at night. And so when you wake up, that is the temperature, and that can help confirm ovulation. And so I wanted to see what's going on. But the reason I'm talking about this is because you can see the temperature here on this row, and her temperatures were extremely low. And so that also helped me to understand that her thyroid was hypo, and that it was suboptimal. And all of her symptoms aligned with hypothyroidism. She was losing the outer third of her eyebrow. She was gaining weight, cold all the time. And despite all those symptoms that she had and went through IVF, nobody even tested her thyroid. And I just could not believe it. So in this case, even though I'm the nutritionist, I helped advocate for her. I did initiate these labs, but then we took those labs to a physician who was able to provide the treatment options for her. Okay, so here's actually an example of a soap note. I just kind of copied and pasted that here today. So that is how I make my notes. And so this was a case that was referral to a naturopathic doctor. I have connected with a local naturopathic doctor. I tend to prefer naturopathic training versus functional doctors who go back and get their training. Just personally, that's my preference. I understand the naturopathic training and nutrition is really heavy in there. So I really appreciate that about their training. In the state of Pennsylvania, the naturopathic doctors cannot diagnose and prescribe, but some other states they can. So this client was a very, very complicated case. She was a young girl. She actually came to me because she recovered from exercise anorexia, and she was trying to, encourage her healthy relationship with food. But so she wanted someone who understood eating disorders, but she also had a lot of chronic illness issues and a lot of mystery symptoms. And I remember our first appointment being quite overwhelmed, and it honestly, things just like did not make sense to me. And every time we ran labs, we just found so many things, and I was overwhelmed. And she told me that she's had 15 surgeries and she was only 25 years old. And so in the course of our time together, she was diagnosed with connective tissue disease or disorder. It's a genetic connective tissue. And so that was, explaining all of those injuries and whatnot. But this was the last time that I spoke with her, actually. She was having like nausea and all of these problems. And the objective here, I wrote that she visited the ER 3 times in 1 week. And she said she had a blood clot in her arm, a pseudo seizure, hiatal hernia, and chest pain. And I was just like, this is at the point where I don't know how else I can help you, because, we've exhausted our nutrition recommendations. Her inflammation, the blood sugar, we've been addressing that for weeks and weeks and weeks, and she was trying. And so kind of reiterating that, the Mediterranean diet and supplements, how I could help her with her nausea, focusing on the blood sugar, maybe ginger. And she really had no interest in eating at that point, which was also very concerning. And so her quality of life was very, very poor. And I had to have the conversation with her. I want you to get better. And I believe that maybe what might be best for you in this situation is prioritizing financial resources to see a naturopathic doctor who might be able to understand and connect some of these dots for you. And I don't know what happened to her. I have not seen her, but I know that referral was absolutely necessary. And that, to be honest, that I don't know, with all of this that I'm hearing, I don't know how else I can be of an assistance. And even, like the ER doctor, they are there for the immediate concern. Like, they are not there to understand her as a whole person. Like, that could never be the job of an ER doctor. The ER doctor is there to address that immediate concern. That is the emergency of why she came into the hospital. So I'm not sure what happened to her. I hope she's okay. Alrighty, so some takeaways. Referring out is a very important clinical skill to have because we care about our patients and clients. Always remember to document referrals. I forgot to mention this, especially if something, if you were ever to be audited or there's ever a legal issue. I mean, if you found something scary, you have to document, communicate that to the patient, and document. I remember I heard this story from a practitioner before. It was kind of scary. There was a husband and wife that was seeing the same nutritionist, and the wife really wanted the husband to have, a look at, and he had a lot of digestive issues. They ran GI map, and he had lots of blood in his stool and lots of scary things that could have indicated very, very, very horrible medical things. And when she told him, he said, "I don't care." And he didn't want to do anything about that. And this clinician, due to HIPAA, she was not able to tell the wife. And she wanted to, help out your husband, but she could not. And all she could do is say, "I highly recommend that you get medical treatment right away. I highly recommend even maybe you go to the ER today." But he didn't want to. And so she documented, and that's all that she could do. Of course, remember, you're such an important member of the healthcare team. I wish that nutritionists received more referrals from doctors. I was pretty bummed when I took insurance, and I was like shocked of like the people that came to me on their own and that their doctors were not referring them. But yes, you're such an important part of the healthcare team, and collaborating is also so helpful for the client. And supporting overall health that's the goal, right? And so if you want to be a good clinician and doing your job, it's also an important thing to understand them as a whole person and where they might need support in other areas. All right, so we are going to have questions, but I just wanted to mention about my supervision program that does focus for women's health and pediatrics. So if you want to visit my website, or I have an Instagram page where I talk about things. So that is a little bit about my supervision program. We have one-on-one support with me, cohort calls, lunch and learns, and then modules for functional medicine nutrition.
Thank you, Emily. Feel free everyone to put questions in the chat if you have them. There was one question that Grace had that she'd put in the chat. When working with outpatient eating disorder, have you ever reached out to a therapist and not received a response? How would you approach this? It seems like they should feel this is important, but how do you coordinate care without stepping on toes?
I've never had someone not agree to work with me for an eating disorder. Everyone understands that they have to do that. It is one condition where the treatment plan after I've had patients come to me after they were in treatment. And so if they come out of treatment, we have to do that. I've never had any issues. And actually the doctors are busy. So sometimes it's difficult to like find a time to talk. Like maybe it's 5 minutes and that's okay. Just to touch base. But no, that's never been an issue. And I think therapists are really open. They love it. They love, because they're so invested in their clients. I mean, they see them like once a week sometimes. So no, I've never had any issues with that.
So I don't see any other questions. So you must have covered it so well. No one has any questions. I did put the CE survey in the chat. We'll give it just a second. And also, if you want to raise a question or ask a question out loud, you can always raise your hand and I can unmute you as well.
I will say I had an interesting experience. There was a client I was working with in New York, and in that state, I cannot order any labs at all because there's a few states, New York, Rhode Island, New Jersey, they're finicky about ordering labs. Like patients cannot order third-party labs. And so this client was referred to me actually from a functional medicine doctor, and she had PCOS. And so she was diagnosed with PCOS, but we had no labs to back it up. And we wanted to explore that. And she did give me permission to speak with the functional medicine doctor, who we were close. We knew each other anyways. And she referred this client to come see me for the nutrition piece. And we were talking and I said, well, what's up with this? She has no labs at all. She said, yeah, I recommended all of these labs for her to get from her doctor. And I said, well, I wonder, I said, I'm happy to write a letter to her doctor requesting this. So I did. This physician wrote me an email that was this long, telling me why she refuses to order any of those labs. She was saying like C-reactive protein has no relevance to PCOS. Like, I assure you, like, we addressed her obesity. We don't need to look at her cholesterol. Like, I could not believe it that this person, they must have crafted this email for 3 hours for me. And so, it was just unfortunate because the patient suffers. And of course, she fired her. She never went back to that doctor. But that was about it for a big fat no. But usually it goes over quite well.
Wow. Yeah, that's a really big fat no, huh?
Oh, it was.
Yeah.
And she included articles and everything, and I just, yeah.
Wow.
The doctor's name was Karen. It was so funny. Her name was Karen.
All right. Well, I don't see any questions. I love, thank you for pointing out the importance of documenting. That always, is so important, that documenting that you referred out. And I think with other webinars, we talked about this before, but just the importance of referrals, this type of referral helping you get clients in the future, right? Because you're building that relationship with the doctor or the therapist, and then they're going to send you people because they know that you're invested and willing to have that care team. And so I think that's important too for building that relationship.
Yep, that's absolutely an opportunity. Absolutely.
Awesome. Well, thank you so much, Emily. And like I said, I put the CE survey in the chat and also a link to our upcoming webinars. And I will send this out to everyone who registered probably tomorrow. Awesome. Well, thank you so much, Emily. And if anybody has questions, make sure you follow up. Emily, do you want to put your email in the chat there?
Oh, yes.
In case anybody needs it.
It's just empowerednutrition@gmail.
Oh, here, I think it just went to me. Let me put it to everybody.
Oh, I'm so bad at technology.
It's all right. It defaults to just me and Grace, so there we go. Awesome. All right. Thank you, Emily, and everyone have a wonderful afternoon, and we'll see you at our next webinar.
All right, bye.
Bye.